In this video, we will be covering maxillary second premolars. The maxillary second premolars are tooth numbers 4 and 13 in the universal numbering system. We will be looking at number 4 today. The maxillary second premolars begin to calcify at 24 to 30 months, complete their crowns at 6 to 7 years, erupt by 10 to 12 years, and complete their roots at 12 to 14 years. Though these teeth share many features with the maxillary first premolars, they have a few differences. Maxillary second premolars tend to have smaller and rounder crowns than the maxillary first premolars. However, they have a longer root than the maxillary first premolars. They also possess more occlusal surface irregularities. Maxillary second premolars usually only have one root and one root canal, while maxillary first premolars usually have two roots and two root canals. First, on the buccal side, many of the features applicable to the first maxillary premolars are seen here as well. For example, you can see the trapezoidal shape of the buccal aspect along with the buccal ridge with developmental depressions on either side. One key difference is that the buccal cusp on this tooth is shorter than the cusp on the maxillary first premolar and will be less sharp as well. Looking at the mesial side, we can again see that these cusps are relatively the same length, which sets these teeth apart from the first premolars, which can best be seen from the proximal. Just like the maxillary first premolars, the cusp tips are within the confines of the root trunk. Take note that unlike the maxillary first premolars, there is not a developmental depression going along the mesial surface. And as a note, the proximal height of contour for all posterior teeth is in the middle third of the crown. From the lingual view, we can see that the lingual cusp is in line with the buccal cusp, which is a way you can differentiate the maxillary second premolar from the maxillary first premolar, which has the buccal cusp tip distal to the midline and the lingual cusp tip mesial to the midline. In the distal view, we can see that there are a lot of similarities to the mesial view. However, the distal marginal ridge is shorter than the mesial marginal ridge. From the proximal view, this tooth is thicker and wider at the cervical area compared to the maxillary first premolar, which constricts at the cervical area. As mentioned before, the occlusal surface of the maxillary second premolar has more anatomical features than the maxillary first premolar. One major feature present in this view is the short central developmental groove which joins the mesial and distal pits. However, there are multiple supplemental grooves that give this surface a wrinkled appearance. Compared to the first premolar, this tooth is smaller, yet it has a larger occlusal table and is rounder, making it resemble an oval rather than a hexagon. These teeth usually have a single root and a single canal. There is no mesial developmental depression, but there is a distal developmental depression on the root. The maxillary second premolar's roots are longer than the roots of the maxillary first premolar. That finishes up our review of the maxillary second premolar. Check out the rest of our dental anatomy videos on mydentalkey.com. The 3D images used in this video were brought to you by BoneBox. BoneBox is a great resource for learning dental anatomy. Check them out on the App Store today.